Hello, my name is Tim Bale and I am co-director of the Myelin Institute here at Queen Mary University of London. Welcome to another of our series of videos on the COVID-19 crisis. Today, my friend and colleague, Professor Sophie Harman of the School of Politics and International Relations here at Queen Mary, is going to be discussing the response of the Trump administration to the crisis with Sarah Davies of Griffith University in Australia. And they're going to be making the point that while Mr. Trump in particular has come in for some very heavy criticism of his handling of the crisis, actually leaders all around the world and their response to the crisis may leave a little bit to be desired. If you like the video, please do share it and please do come back for more.
Hello, I'm Sophie Harman. I'm a Professor of International Politics at Queen Mary University of London, where I specialise in global health politics. And today I'm really excited to be talking to my friend and research buddy, Professor Sara E. Davies from Griffith University, who, among other things, she does work on women, peace and security. She is one of the biggest global health security experts in the world. She wrote this fantastic book, Containing Contagion, which if you haven't read, I highly recommend it. It was one of the books I grabbed off the shelf from my office, actually, when I realised we were going into self-isolation and lockdown here in the UK. But instead of talking about global health security more broadly, I'd actually quite like to talk to you today about Donald Trump and the US, if that's good with you, Sarah.
Yes, hello Sophie, that sounds very good.
Great. And the main reason is that we know now that the US is becoming the centre of the COVID-19 outbreak. And I just checked on the tracker on Johns Hopkins that there are 368,449 confirmed cases in the US. I mean, that's quite huge, isn't it?
That's massive, and that's the cases that they've been able to test. And so we know then that beneath or above that will be probably a larger number again of outbreaks that are occurring.
Yeah, absolutely. So with these figures, they're the ones that we can see that are getting tested mainly in hospitals and health centres as well.
Exactly, yes.
Yeah.
And what I think we're also going to see is, and what we have seen already, is that it's about who can get access to testing and who is able to be able to then receive the treatment that they need. And yeah, there's some really heartbreaking stories that are coming out at the moment about what's happening in the United States, as it has been around the world.
Yeah, absolutely. And part of the reason I wanted to talk to you is 2 years ago, we wrote an article about Trump. And so when Trump got elected, we were asked by the Review of International Studies to contribute on what this meant for global health security. And I remember at the time we said that Trump would kind of follow the classic security playbook of blaming others, closing borders, imposing travel sanctions, and then previous to that being kind of very disinterested, disregarding global health. And unfortunately, that seems to have been the case.
Yes, very much so. I mean, yeah, at the moment, there's no joy to be had in finding out that some of the things you predict are correct, or are coming into play. But I think, yes, one of the things that we identified was that Trump was certainly going to be, to put it in diplomatic language, a problematic figure in the global health security space, because there was this disregard for the importance of international cooperation and the types of sort of the dependence that we will actually have at some point in an outbreak emergency to try and coordinate the response in a collective way. Having said that, I think what we're seeing as well at the moment is that Trump is not alone. And sadly, he's got company when it comes to going alone in this outbreak. And that's been building up also for the last couple of years in the way in which international cooperation has been happening across a range of different areas, not just health.
Yeah, absolutely. Because I think in the article as well, we said that, Trump's potential handling of an outbreak would not make him an anomaly in global health governance. And I think a lot of people are focusing on Trump right now, understandably so, because of his failings in this area. But he's not an anomaly as well. So we have Bolsonaro in Brazil. But are there other states, do you think, that people should be looking at as well?
Well, I mean, this is the controversy, right? And a lot of people are asking about China and what's been happening there, and the degree to which we can trust the figures and can we trust the information that we're receiving. And I think we've also sadly seen a lot of discussions around what's been happening in Iran and the degree to which there was knowledge of the outbreak and then what was done then in response to it by the political leadership there. And then very sadly, I mean, I think we've seen in Indonesia, closer to Australia here, that there's been, I think, difficulty at the executive level in understanding how to respond to this outbreak, how to communicate it to the population. And, you know, we now know President Jokowi, you know, hesitated to report those first cases. And that has an impact then on the way in which populations trust the information that they are receiving from their government. And it also then has a wider impact on their neighbours and the degree to which there's confidence in the response. And I think we're seeing this. I think this is the sort of the flip side then of what Trump and Bolsonaro and others, they calculate that in this instance that that kind of aggressive stance is going to be received by their supporters and make them feel reassured. But actually, in an instance like this, what I think it's revealing is that it's a lack of knowledge, it's a lack of planning, and it's not having, you know, what it doesn't play to the playbook that they've been setting up to at this point about, you know, being the man in charge. And I think it's too soon to tell at this point how it's going to play out. But yes, sadly, I think there's a bit of company here at the moment in terms of how certain states have been trying to manage it at that executive, very, you know, top-down level, hedging their bets about how they need to play out the response in the first instance. And it's cost lives.
Yeah, very much so. And that's really interesting what you said about the role of trust within our political leaders, and this kind of big man politics doesn't work. You can't do it that way because it requires the trust, but also cooperation among not just scientific communities, but community groups, all sectors of government. Everybody actually has to work together in this way.
Yeah, and I think that's why we sort of, the preparedness discussions have always been around, you know, when we're looking at a disease outbreak event. And if you ever look at a lot of the research that's been done around preparedness and discussions around preparedness, there's always this focus on the executive leadership. Are you able to convene the type of response that needs to come at the top so that it can be filtered all the way down across your systems of governance? I've been a critic, and so have you, that one of those things that we also need to make sure when we're thinking about those types of structures, that we have non-government organisations that are included and part of those discussions, that we have we have recognition of the fact that different populations are going to receive and act upon this information differently. So you need to be thinking through the different ways in which you communicate the type of response that you're going to get out. But I think what's also been interesting about this outbreak as well has been the essential need to communicate through a range of different mediums as well. So the idea that you can deliver from, you know, the front of your garden to your presidential palace, sort of a message to everyone at a set time at that day, and everyone's going to be watching, is not the case anymore. And I think that's why what's been really significant, if we look at countries such as Germany, such as New Zealand, such as South Korea, we've seen them deploy a range of different types of risk communication strategies. There's been a deliberate attempt to kind of almost saturate all the different types of social media, conventional media, with messages of both that are consistent in terms of what the science is telling the politicians and then what the politicians are communicating to the science, you know, so investment in testing, investment in contact tracing. Even when lockdowns are announced, there's a consistency and there's an effort to make sure that there is a consistent message. And then also there's been evidently as well a desire to make sure that that message is being understood by a range of different actors. So they're not just trying to communicate to their base.
Yeah.
There's a deliberate attempt to make sure that everyone is partaking in it. And particularly what I think has been really important as well is, if we look at New Zealand in particular, I think is a good example where very much straight off the front foot, there was an effort to make sure that, the communication messages were in a range of different languages and that they were delivered to ensure that people who may have concerns about how it was going to affect or interact with their faith or with their cultural practices, that there was an effort by your more provincial level health communities to make sure that communication was being delivered to them. And so I think that's what we've actually see here, that actually that kind of aggressive top-down stance isn't really going to work in this instance. It really needs to be responsive and recognition, needs to recognise that people need actually a lot of information, but it can be delivered in a way that is transparent and on a journey together.
Yeah. Okay. So on one hand you have sort of New Zealand, and then the other hand you have the US model of what Trump's doing. Well, not the whole of the US, because we know that there is effective communication happening there. It's just not coming from the president effectively. And so my last question is, we do know that one thing Trump does like is being elected president. So do we think this pandemic is going to impact on his presidential chances? Have we seen this? I was trying to think the other day about that relationship between public health emergencies and electoral success as well. And in cases, and I know in Sierra Leone, it's, you have that kind of politicization of Ebola and people being involved in the Ebola response and things like that. Sorry, this is a long-winded question of what do you think is going to happen with the presidential election? Do you think this is going to have an impact? Do we have any evidence from before? I'm
not a United States expert at all.
No, sorry, I'm just making you comment on it for fun.
Right, well, I'll comment anyway, I don't mind. I guess for me, there was a strong indication, wasn't there, at this point, that in terms of any challenger that he faced, it was going to actually be a bit tougher than what, perhaps people hopeful that he wouldn't win. It was going to actually be quite a tough race. There was a lot of hope with Biden that, he'll be able to secure a little bit more in the Electoral College. But I think what you're seeing at the moment is, in an emergency situation, there's an inevitable turn to the leadership of your country. And in some respects, it's going to be almost natural and inevitable that people are going to turn to and cling to the leader that they have, because what they want more than anything is stability, and they want just to move forward. And the idea of any type of change at that moment is going to be terrifying. And I think that's why there's a lot of concern. Like, we can look at the United States and say, well, there's going to be another 4 years of Trump. But I think we also need to look to other areas that are very politically fragile and politically precarious, and see that this could really go authoritarian's way. This could really support and benefit more aggressive moves to try and remove political opposition and take away their voice, take away their access to the types of communications that they would normally have under this, state of emergency response at the moment. Yeah. So I think again, and I think, and it comes back to something that you were saying earlier about Trump, in terms of the border lockdowns, and we predicted that there would be this very aggression isolationist policy. I think, to be honest, that's something that most countries have done. They've all gone for an isolationist policy, and I don't think we can necessarily condemn the states for doing that. I mean, it's something, and in fact, that probably brings bigger questions then about the World Health Organization and their insistence on not having trade and travel bans, because it's. I think that's going to change. I think this is going to change that forevermore, and I know you've been talking about that. So I think. I think where was I heading with that? I think what that means then is that when we look at some of the things that Trump has been doing, I don't think he's going to actually stand out that much from the crowd. I think perhaps where he has erred tremendously was in the first instance, and that sort of hedging his bets and prevaricating and, and not knowing how to basically respond to that. to what was clear evidence before him that it was coming. But again, you know, he's got company there. There's been a fair few other locations where tragically that has happened as well. So I think populations are probably going to build a certain amount of tolerance for these kind of mistakes in the early part, partly because a lot of populations weren't necessarily there themselves, you know, in terms of understanding how serious it was and is, and how potentially catastrophic it will be if we don't deal with it. And so I think that will give him a little bit of protection going forward.
Right. So Trump's not an outlier. There is going to be this relationship between pandemics and authoritarianism. It's not looking too great. But Sarah, thank you so much for your time, as ever. Thank you so much.
Pleasure. Thank you.